And thank you both for your presentations. A lot of the questions really that I would have had have been answered, so I've only two brief questions, but I do. I apologise for interrupting Deputy Fitzpatrick earlier on, but I think it's a point that's worth noting, and I probably should have waited my turn. But it's just, in relation to adoption and whether it's decreased or not, I think when we're having any kind of conversations about women and the choices they've made now or in the past, we really need to look at it in the context of our history and the amount of women we locked away, we put in mother and baby homes, and the amount of illegal adoptions that actually happened in this country. And if the research is not there, I'm sure it factors in along the way if research was ever done. And I think it's important to say that, because I don't think any of us would want to ever advocate that we want to ever go back to those figures. So it's just being mindful of those women and the fact that they probably would have chose actually to rear their children had they been given the support to do so. So that was the point I was trying to make. But just to come back, I suppose, to kind of keep it around this socio-economic stuff, it's just two questions. One question for me is, and it's more just looking for clarification from you, is I know throughout my time supporting people and mothers that already have children, especially in if they're at risk of homelessness or they're in addiction, and they're always very, very cautious of seeking help, especially from state bodies. There's sometimes some distrust there, and I'm just wondering, like, if somebody's experiencing addiction, how does the counselling operate then? And women do be petrified sometimes as being judged as mothers. They're worried maybe the children they already have might be taken off if they raise why this pregnancy is such a crisis. So I'm just wondering how you deal with that, and if you come up against it at all, or if there's a whole cohort of women that don't access you because it is a state organisation, and how can we actually address that? And this kind of is a similar question. You know that a socio-economic inequality exists in being able to travel for abortion, with poorer women being more likely to turn to the abortion pill. And I'm just wondering, what's your take on the overall impact of the socio-economic status or circumstances of a woman on her options in a crisis pregnancy?
Okay, I mean, in terms of a client who may come with additional needs in terms of addiction, I think certainly the crisis pregnancy counselling services are absolutely open to these women, but you're right, they often don't see themselves go into those kind of services. They may be fearful, they may not feel that it's for them, they may feel there's another agenda there, or whatever that might be. I think what we've done in the HSE is that we have tried to provide training and support to services that are already engaged with these women, so through addiction services. So we would fund NUI and Maynooth to provide masterclasses on particular topics around crisis pregnancy, and they're open to anybody that works in the HSE or any of the funded services. And recently, and more recently I suppose, a vast array of services are attending those masterclasses. So there would be addiction counsellors attending them, there would be public health nurses, there would be other areas of the HSE, and I suppose it's about providing them with the knowledge and information to be able to then go back and support their client. But equally, a counsellor will see a client from with any kind of additional needs, but may not always be able to support them fully, and may need to then refer them back for additional support. And then I suppose the second question was around the...
It was around asides of just one option, say, in terms of in relation to the impact of their socio-economic circumstance on a woman, on her options. Like all options might not be available to her given the circumstances that she's in. So it's probably quite a broad question, and the earlier contributor before you said that there's as many reasons as there is pregnancy, so it's such a wide range to capture. But it's just that we think that we have options, and we think we have a choice in those options, but sometimes because of our socio-economic maybe disadvantage or circumstance, that even our options are limited. So I'm just wondering, is that the case, or
Yeah, I mean, I think you're right. I think the options are more limited for those, with lower financial means, with in domestic violence situations, and in a multitude of situations whereby they are not able to make the choices that their counterparts with financial means, are. I suppose if we take the example of asylum seekers in particular, they are restricted, I suppose, in terms of their economic ability, their social ability, and the procedure that they must go through should they choose the option of abortion in terms of travelling outside of the state for an abortion. And they can be unsurmountable, to many women in terms of going through with the option that they have chosen. So absolutely, I think there are a range of additional issues that influence a woman's ability to make a decision and follow through with that decision.
Thank you. Thank you. Thank you, Senator.